she would have survived, and that would be making sure that he got the help that he needed, and because putting him in like prison isn't going to help anybody.
A mother advocating for help instead of prison for her daughter's killer. She blames her daughter's death not on the man that murdered her, but on Oregon's failing mental health system. Good evening. Thanks for joining us for K2 News at 6. I'm Deborah Knapp.
And I'm Mike Asway. Tonight, some Oregon lawmakers are working to make changes about when someone with a mental health illness could be forced into treatment. K2's Christina Jarnelli is live now in Southeast Portland to break this down. Christina, it would make it easier to commit people to the state hospital against their will.
Yeah, right. It's what's called a civil commitment. A judge makes this call when a person is a danger to themselves or others. Some in Oregon say that the bar is too high. Others say that making it easier to force mental health treatment would harm people with mental illnesses. In the past, it used to be much easier to commit people to mental health institutions in Oregon. So much so that there were numerous documented cases of abuse in those places. But some say when Oregon changed its civil commitment laws in the 70s, it swung too far in the opposite direction.
There's a great deal of confusion and inconsistency across the state as to who is eligible for commitment.
Casey Liddell is Oregon Governor Tina Kotek's behavioral health policy advisor. He says the way Oregon's laws are written makes it very difficult to involuntarily commit people who are a danger to themselves or others.
Judges are generally only allowed to look at whether the threat of harm is imminent, which is widely interpreted as meaning that the person will harm themselves or others within minutes or hours if they are not committed.
House Bill 2467 clarifies that a judge should civilly commit if that threat is likely within 30 days. It also provides examples of evidence judges can rely on to make that call. Liddell says it also provides health for people in jail.
The bill makes it clear that simply being in jail does not prevent a person from being eligible for commitment.
He says the way Oregon's laws are currently being interpreted means jails are expected to provide for their inmates' medical needs, including mental health. The bill has seen a lot of debate from mental health advocates on both sides. Oregon Governor Tina Kotek's wife, Amy Kotek Wilson, says as a former mental health worker, she knows firsthand what happens when people who can't care for themselves are not civilly committed.
I have seen patients lose their housing, access to critical medical care, relationships with their loved ones.
Sarah Smith says she watched the harm 12 civil commitments and involuntary mental health treatment had on her daughter.
This day, we are traumatized by her past psychiatric treatment. We don't feel we can fully disclose information safely to medical care providers out of fear that they will distort what we tell them or overreact.
She feels the bill will take freedoms away from people with mental illnesses that are not violent. Now, if you want to dig deeper into both of these perspectives, you can find full-length, unedited videos and full-length interviews on our website right now at k2.com. For now, live in Southeast Portland, Christina Giardinelli, K2 News.
Christina, thank you for that. We started digging into that bill after hearing from the mother of a mental health worker who was stabbed to death. It happened at a Gresham group home in 2023. Meshell Rogers was the only employee working that night. Another worker didn't find her until the next morning. Earlier this week, a Multnomah County judge found 61-year-old James Smith guilty except for insanity for causing Rogers' death. Now Smith is being sent to the Oregon State Hospital. The Psychiatric Security Review Board will decide if and when he should be released.
Cascadia Health, one of Oregon's largest behavioral health providers, owns the group home where Smith lived. The union who represents the workers says employees like Meshell Rogers had been asking to not work alone on the night shift. We reached out to Cascadia today to find out what changes have been made since then. They say since July of 2023, they've been scheduling 2 staff members for all overnight shifts. We asked for an interview. They declined, but sent us a statement. Cascadia also sent this statement that says, the work we do is challenging and vital. We value safety and strive to build a culture of safety agency-wide.
After the worker was killed, Oregon OSHA investigated and cited Cascadia Health. Cascadia also paid more than $7,000 in fines. Some of the citations were for lack of protections for employees, lack of supervision of equipment, lack of crisis intervention training, and unclear policies and accountability for safety. According to an OSHA report, Cascadia took several corrective actions. That includes adding staff, securing sharp objects, and the addition of walkie-talkies and body alarms.
A Multnomah County Deputy DA also spoke about Smith's commitment to the state hospital and how the system works in cases like this. He said while Smith poses a risk to the community, he should also be able to get treatment.
This is the available, remedy when somebody commits a violent crime as a direct result of the psychosis that's coming from a serious mental health disorder.
He went on to say Smith would only be released if he's in complete remission.
In 2022, K2 reported that 3 Oregon hospital systems sued the Oregon Health Authority over long wait times for patients to get in to the Oregon State Hospital. OHA oversees operations there. The lawsuit claimed patients committed against their will were instead being left to languish in acute care settings. In response, OHA says it was simply following federal rules. K2 is working to get an update on the status of that lawsuit.
This, of course, is a developing story. For Christina's extended interviews on both sides of the story, head to KATU.com.